Hello, folks. I'm talking today about documents that reveal a glimpse into Canada's early Convoy 19 plans. Juicy stuff. Alright. Early on in 2020, the message from the federal government was that the coronavirus risk here was low. But the rapidly spreading disease eventually reached Canadian soil, setting off a cascade of ever-evolving politics, from the advanced giving bias based on the virus' ability to spread to measures needed to the border and need to inventory of medical supplies, internal documents show. In early January, the government went from saying the novel virus was being actively monitored with no confirmed cases in Canada. By mid-March, the government had reparated citizens, assessed national stockpile of supplies, and was having to update public health advice with the suggestion that up to 70% of the country could contract the disease. These are evolutions in the policy relating to the evolving understanding of every before documented virus, are documented in part through hundreds of pages of departmentally redacted documents obtained by ctvnews.ca. The documents offer a glimpse into the early stage federal conversations and policy decisions made in the months after the novel coronavirus is identified and labeled Convoy 19. I'm just having a long day. You can see me in my PJs. Alright. Across the documents, and one of the most oft-repeated statements was, "This is an evolving situation." Some examples of just how fluid the situation was included initially considering sending the tons of supplies headed to China on one of the chartered flights, repatriating Canadians, stating that the virus wasn't enough to be easily spread without prolonged close contact, and indicating a suggestion of closing the border to international passengers wasn't necessary.
The newsletter, sign up, get the COVID-19 brief sent to your inbox. Google.ca, beta.ctvnews.ca.
The information contained in the documents provided in the House of Commonwealth Committee on March 15th. The more than 100 pages were provided a response and production order passed by the committee, and requesting all documents, including briefing notes, memos, emails from senior officials prepared for the Minister of Health, Minister of Transport, Minister of Public Safety, Minister of Foreign Affairs, and the Minister of National Defense regarding the outbreak of the coronavirus. While the committee has yet to publish the documents, they are considered public, and have some of the first documents produced about this federal government's Convoy 19 response, given the federal access to information system has largely been halted. In the weeks of policy making that have gone on since these documents were turned over to the committee, the Convoy 19 pandemic has continued to rapidly evolve, rendering much of the information with these pages dated, though they are an indication of a cross-government collaboration occurred in the early stages of the outbreak. During this daily address on April 7th, Prime Minister Justin Trudeau stated that the situation evolves, so too will their approach, adding that they've done that from the beginning. This is a never-before-experienced pandemic that is presenting new challenges in every single day, new facts, new data every single day, and throughout we are making decisions based on the best advice, he said. Here are the main takeaways. Focus on coordination, controlling its spread. Throughout the crisis, the federal government has stated and reinstated ongoing collaboration and contact with their provincial and territory counterparts. The absence of this was identified in a serious flaw corresponding to the 2003 SARS pandemic, and efforts have been made to indicate that this lesson has been learned. As of as of late January, a few weeks after China had investigated the novel coronavirus, officials were preparing regular briefing documents, largely in talking points and the question and answer suggestions labeled confidential advice for Health Minister Patti Pajadu to use during the calls she had with her provincial counterparts, where the coronavirus was a central topic for conversation. The documents indicated that Chief of Public Health Officer Dr. Theresa Tam and her deputy Dr. Howard Nuhu also took apart these calls with the provincial and territorial health ministers and health officers. The calls during this time period touched on the international standing of cases and highlights of the epidemic and risk to Canada. Talk of establishing domestic readiness and wording around the ongoing coordination across jurisdictions appear repeatedly. They also prepared for a Jan 38 call show at the risk of Canadians to remain low, as she was saying publicly at the time. At the point where the first few confirmed cases were already identified in Ontario, British Columbia, from people who had been in Wuhan. The talking points from January 30th include nothing but preventing the virus from arriving in Canada was next to impossible because of global travel, and instead of the domestic focus should be on controlling its spread. By mid-February, the message was that the federal scenario planning had begun to recommend further measures and had to look at the social and economic implications should the situation continue to evolve. Around the same time, the reputation from Canadians from China was underway, and plans to rescue those stuck abroad cruise ships had begun. Details of the quarantine at the CFB Trenton to the NAV Canada Centre in Cornwall, Ontario were discussed on these calls. It was also flagged in mid-January that the cruise ships were a key challenge to internationally containment efforts, though it took almost an entire month before the federal government announced it was delaying the start of Canada's cruise season from April 2nd to July 1st. Assessing stockpiles, noting market pressures. As of February 10th, an assessment of the stockpiles of personal protective equipment was underway, and the attempts had begun to procure more supplies. A briefing for a Hajdu call with her counterpart indicates the Public Health Agency of Canada had begun surveying the provincial and territorial ideas of vulnerability and options to ensure sufficient domestic supply. It appears that there is another line following is referring to the supply across Canada though it was redacted. Oh my goodness, this is intense. Alright. The advice, the document also noted that attempts to produce the N95 and surgical masks are underway, with delivery set to be staggered by industry due to mounting market pressures. A week later, work was being done to conserve and coordinate PPE supply across jurisdictions. A briefing note for February 19th indicates, now nearly 2 months later, that push to get those much coveted products from abroad remains a struggle, and federal government has asked domestic companies to pivot their production lines to start manufacturing the life-saving supplies Canada frontline workers need, after admitting the government likely did not have enough stock. Evolution of border measures. Manitoba conservation officers provide COVID-19 information sheets to drivers and vehicles as they enter Manitoba from Ontario on the terms Canada on the Manitoba-Ontario border Saturday, March 28, 2020. The Canadian Press, John Woods. In emails and documents provided for the Public Safety Minister, Bill Blair, dated February 12th and labeled CBSA support for COVID-19 response, department officials prescribed how they had been asked to assist. CBSA said that the documents that the border agency was asked by the Public Health Agency of Canada to help them collect information from travelers to assist in contact tracing. At the time, it was limited to travelers who had been in Hubei province in China for the last 14 days, but could not be expanded to other travelers in the future in the future required. The document stated that the two agencies had created a basic contact information form for those returning to Canada, said that they had been and who by was seeking the minister's approval to produce a form to distribute it to all major airports in Canada. The information would then be passed to our PHAC to follow up with these people, and CBSA was recommending immediate implication of the contract tracing. The form was approved and implemented within a week based on all the references to the documents. The form based on examples included in produced documents included questions about information such as a phone number, address. The travelers were also asked what seat they occupied on their returning airplane and how long they planned to stay in Canada. A total of 1,267 travellers said that they had been to Hubei province based on data collected from travellers selecting yes to that question on their kiosks when entering Canada as of 4 p.m. EDT on February 11th, according to the documents. Of those who were 846 were Canadian citizens, 122 were permanent residents, and 299 were foreign nationals coming for a variety of reasons, largely from Canada, from China, and the United States. As of February 22nd, a total of 2,226 travellers have identified and returning from Hubei province, with 31 referred to the Public Health Agency of Canada. Of those, 3 were referred for medical examination. Other CBSA documents show the approved response prepared for questions about preparedness, signage, and other screening at airports. The protection measures in place for the border agents, all accurate measures Blair stated publicly in the early stages of COVID-19's arrival in Canada. Discussion around the Imposing Quarantine Act on returning travelers is happening as well as mid-February. That decision was taken weeks later after hundreds had completed their forced 14-day isolation at federal facilities after being brought back by the government. The conservations around shutting the Canada-US border to non-essential travel, banning most non-citizens from entering Canada, do not appear on any of the under-acted pages and turn over to the committee. However, the question of whether Canada could close its borders and still banning flights from China was included with a series of prepared responses and potential questions very early in the outbreak. The response was no. The Government of Canada and provinces and territories have multiple systems in place to prepare for, detect, and respond and prevent the spread of serious infectious diseases in Canada. We are also aware that China has taken extraordinary measures. At the time, this approach was in line with World Health Organization's advice. Now, I'm going to have to take a break on all of this. First of all, because there's another like 3/4 of scrolling pages and I'm already at 15 minutes. So perhaps maybe I'll read the brief on billions in economic losses, because I know we all care so much about that. Money makes the world go round. So maybe I'll just do that tomorrow, or perhaps later. I'll be bored and feel like reading the news again. After all, we all know that I am just a girl reading the news, right? Ciao, ciao for now.